Child's Podiatry Q&A with Dr. Wagner, Dr. Tojam. So I'm gonna try to get to 2 questions today. I'm gonna move a little bit quicker just so we can get to 2 of them. Erich, spelled E-R-I-C-H. Question: Doctor, my uncle has been in battle with gangrene for months, losing a toe, then 2 more, then half the foot, and now possibly leg up to knee. My question is, what makes gangrene so hard to get rid of? Is it that they aren't taking enough bad stuff off, leaving a tiny bit to continue its destruction? I'm very curious. He has diabetes, and it's not because of being overweight, but has hard time with sugar problems. The docs had to reroute a vein for better blood flow, but it doesn't seem to matter. I know you are an extremely busy man, so if you don't have time to answer, I totally understand. Thank you in advance. Sorry about that, guys. This is, I think, a fantastic question. It's unfortunate to hear another case as such. I like to call it the trifecta, so to speak. Patients with diabetes, vascular disease, top it off with a little hypertension and a little hypercholesterolemia. And it's essentially a recipe for disaster. Erich here is telling us that he has a family member who has been battling gangrene. And the problem with gangrene, right, in these very brittle patients is that, make believe we take a tree and we flip the tree around, right? You have the trunk at the top, and then we have the branches, the larger branches, and off the larger branches we have twigs and then the leaves. And that's an analogy, right, of the arterial system in our lower extremities. The problem is that even though he probably had, what I'm understanding from this question is that he probably already had a bypass, and even with a bypass, there's not enough blood flowing down to the lower extremities. So now going back to the analogy, sometimes you need to, because of, again, I don't know this particular patient, and does he smoke, does he doesn't? Let's just say that maybe he does. Microvascular disease is a huge problem. So even when you exhaust the arterial bypass, even when you exhaust the endovascular intervention, or any type of arterial intervention, sometimes it's just not enough to salvage the foot, because there is simply no way to get blood down to the toes or to the foot. So what happens is we now have to work backwards. We have to turn around and start moving upwards, right? To look for the blood. Where is the blood? So it doesn't really matter. What truly matters is the $1 million question. At what level will the tissue heal? And I've seen many cases where they have had to go all the way up to the knee or below the knee and perform a below the knee amputation to save the patient's life. Because gangrene, right, as an infection, can put the livelihood of a patient at risk. We're not going to talk about the importance of obviously the HbA1c, the very important marker that tells us how the patient has been monitoring his daily blood sugars. This is another unfortunate case where no matter how great these vascular and endovascular surgeons are, sometimes you need to sacrifice, right, more tissue instead of piecemealing one toe, then another, then a little bit of the foot, and then a little bit of the ankle. It's not worth it, because we can easily put the patient's life at risk. And I hope with that I've answered, Erich, E-R-I-C-H, I hope I've answered your question. Another question that I'm going to answer today, I'll make it very, very short and sweet. Karen has been following us for a very long time. Thank you, Karen. And Karen the other day asked us, she brings up a very good point. What do we do as podiatrists, right? A lot of people think that we only chip and clip, so to speak, right? That people come to see podiatrists to trim toenails or trim calluses. I can only speak on behalf of the state of Florida and the scope of practice that we have here. But, I had the good fortune of getting, doing my 4 years of undergraduate school and then my 4 years at School of Graduate Medical Sciences in podiatry, and then I went ahead and did a 3-year surgical residency in essentially rear foot and forefoot, which means anything below the knee, leg, ankle, and foot. And throughout the years, I've had the good fortune of being able to really take care of patients with problems, again, anywhere from below the knee to the tip of the toes. Whether it's patients from pediatrics to geriatrics, from a simple trimming of toenail to a complex application of an external fixator or reconstruction of trauma and or fractures. Here at Jaws Podiatry, we essentially do it all. From simple podiatric medicine to regenerative medicine to trauma. And the key to Karen's question is education, right? Because a lot of people don't really know what we do as podiatrists. And even till this day, we continue to educate the community. Not all podiatrists are created equal. The arena in podiatry has changed tremendously. Aside from sports medicine, trauma, treating patients with acute pain, heel pain, Achilles tendonitis, you guys have seen a lot of what we do as limb salvage experts, wound care experts. We're very fortunate to be able to treat patients from all walks of life with all of the different types of pathologies that we see in the lower extremities. So if anyone has any other questions in respect to what we do, I can only speak on behalf of the state of Florida, right? Our scope of practice in other states, the scope is different, but we continue to really render the best possible, unforgettable foot and ankle experience here at Jaws Podiatry. I want to thank everyone for their interaction in our YouTube channel. I want to thank everyone for taking the time to write questions or simply watch our videos, and it really means a lot to us. we have 5 doctors on board. You guys all see primarily myself, and I'm trying to convince the other guys to show their face a little bit more, so you guys get a better feel of not only the our staff, but also the doctors that are part of this wonderful organization, JAWS Healthcare. So with that, I leave you guys. I hope that everyone either good morning, good afternoon, or good evening. Thank you for watching this video, and please, I do continue to see all of your questions. I will definitely try my best to get to each and every one of them. Like always,